The nurse looks at the patient's face and body for 1 minute to note any visible reactions. At the end of 1 minute, she gives a score for all items except for muscle tension. The nurse then holds the patient's arm in both hands, one hand at the elbow and the other hand holds the patient's hand. She then performs passive flexion and extension of the upper limb and feels any resistance. If the movements are performed easily and there is no resistance, the score is 0. If the movements can still be performed but with more strength, thus indicating resistance to movement, the score is 1. If the nurse cannot complete the movements due to strong resistance, then the score is 2. As a patient is being turned, the nurse looks at the patient's face to note any reactions such as frowning or grimacing. These reactions may be brief. As noted on the CPOT photos, a score of 1 consists of a tense face, which is usually exhibited as frowning or brow lowering. A score of 2 refers to grimacing, which is a contraction of the full face, including eyes tightly closed and contraction of the muscle of the cheeks. The nurse also looks at the body movements. For instance, a patient may be trying to reach or touch the site that is painful. This would be a score of 1. If agitation is included in the patient's movements, this would be a score of 2. Ventilator compliance is assessed by seeing if the patient is coughing and if the alarm is going off. If the patient's coughing and the alarm stops spontaneously, this is a score of 1. A score of 2 would be if the patient fights the ventilator. If the patient isn't intubated, you will hear or may hear certain sounds, such as moaning or crying out. Muscle tension can be felt by the nurse if there is resistance to movement. A score of 2 is given when the patient is resisting and attempts to stay on his or her back. The patient could also clench their fists.
Let us now have you practice using the CPOT on 3 different ICU patients. You will be seeing 3 different video clips demonstrating different patient behaviors. Using the CPOT tool, which was provided to you as a handout, assess and score the 3 different patients. Here with me is Dr. Kathleen Pentillo to discuss the 3 video clips. We will now see Mr. Dennis. So the patient is at rest. Face looks relaxed. The body looks relaxed as well. No alarms. So the baseline CPOT score would be 0. Now the patient is being turned. We can observe little frowning and weeping eyes. Some shivering here. The alarms are on. So repetitive movements of the arms, he's resisting the movement. So that would be a CPOT score of 5.
I agree. Okay, so now we're going to take a look at our second patient, Mr. Doucet. And you can see that Mr. Doucet is very similar to the previous patient at rest. His CPOT score is 0. You can see that there are no facial expressions that indicate he's having pain. His body movements are virtually absent. Now we're going to see him when he's going to be turned, and we'll see the differences. Here you can take a look at his face, and you'll see that there's some grimacing, there's some frowning, his eyes are tightly closed. Now there's the ventilator. He's kind of alarming the ventilator during this turn. He was also hugging the pillow over his sternal incision. I'd actually give him a 5. He resisted movement, or maybe even a 6.
You're right. It remains unclear if the patient is fighting the ventilator or not, because this video clip is so short. In real-time observation, the nurse would get a better idea of this indicator. So let us now talk about the third video clip, Mrs. Asia. So we're seeing her at rest. Her face is relaxed. There's no frowning, no grimacing. And now the body view. She's lying quietly, no body movements, no alarms. So would be a CPOT score of 0, like the last two. So we're now seeing her during turning. A second view. Oh, a little frowning, and she closed her eyes. The turning is easygoing. She doesn't seem to resist.
I agree.
And no alarms. So it would be a CPOT score of 1.
Of 1.
All 3 patients that we viewed on the video clips were intubated. However, it may happen in your practice that the patient you are assessing is not intubated. In such situation, the nurse would look for the patient's vocalization. A patient who is talking normally or remains silent would get a score of 0. A patient who is moaning or sighing would get a score of 1. Here is an example of a patient with a score of 1. A patient who is crying out or sobbing would get a score of 2. Here is an example of a patient getting a score of 2.